You know, in medicine, some drugs are just fascinating paradoxes. And today, we're diving into one of the big ones, cyclophosphamide. This is a compound that is absolutely central to fighting cancer and to calming down severe autoimmune diseases. But here's the catch. Its incredible power to save lives is perfectly matched by its potential to do some serious harm. It's a real double-edged sword. So just imagine for a second your own immune system, your body's personal army, goes rogue and starts attacking you. It's a terrifying scenario. For people with severe lupus or a condition called systemic vasculitis, this drug can actually step in and tell that attack to stand down, preventing devastating damage to organs like the kidneys. And here's the wild part. At the exact same time, in a hospital down the hall, a different patient is getting the exact same molecule to wage an all-out war against their cancer. We're talking lymphomas, leukemias, breast cancer. It's a true workhorse in the world of oncology. So that's the big question, right? How can one single chemical act as both a peacekeeper and a weapon of mass destruction inside the human body? And maybe even more importantly, what's the cost? What's the price the body has to pay for using a tool this powerful? Well, that's exactly what we're going to break down. Okay, so to really get our heads around this, we have to understand how it actually works. And the whole story begins with this really clever bit of biological trickery. See, the pill you swallow, it isn't actually the thing that does the job. The drug's journey is pretty cool. First, you take it as an inactive molecule called a prodrug. It's basically asleep. It travels to your liver, and there your own body's enzymes flip a switch and turn it on. This activation process creates the real weapon, a molecule called phosphoramide mustard. This is the stuff that goes on the hunt for a cell's DNA, latches on, and does so much damage that it basically forces the cell to self-destruct. Now, the technical term for this attack is alkylating DNA. It sounds complicated, but the analogy on the slide nails it. Think of your DNA's double helix like a zipper. For a cell to make a copy of itself, it has to unzip that DNA. Well, this drug gets in there and it's like it adds superglue to the zipper's teeth. It creates these permanent bonds, or crosslinks. The cell can't unzip, it can't divide, and so it dies. And here is the absolute key. This process is deadliest to cells that are trying to divide really, really fast. And that detail right there, that it goes after rapidly dividing cells, that is the whole secret. That's how this one weapon can be used on two completely different battlefronts. On one side, you've got the cancer fight. The goal here is pretty simple: eradication. You want to kill off those cancer cells, which by their very nature are dividing like crazy. So you use higher doses. On the other side, you're looking for an immune truce. The goal isn't to wipe out the immune system, just to suppress it. So you use lower doses to dial back the activity of those hyperactive immune cells that are causing all the trouble. It's the same weapon, just a totally different strategy. And believe me, in oncology, its resume is long. It's a go-to for blood cancers like lymphomas and leukemias. It's used for multiple myeloma, even for solid tumors like breast and ovarian cancer. And in its most extreme use, doctors give massive doses to completely wipe out a patient's own bone marrow before they get a new, healthy one in a stem cell transplant. Then, over in the world of rheumatology, it's a totally different story. This isn't your everyday arthritis drug. No way. This is the big gun they bring out for the most severe, life-threatening situations. When lupus is wrecking the kidneys, when vasculitis is closing off blood vessels, that's when you call in cyclophosphamide to stop the immune system's friendly fire. But all of this power comes at a price. A heavy one. The drug's greatest strength, its ability to kill dividing cells, is also the source of its biggest dangers. It's a powerful tool, but it's also a blunt one. Because here's the thing. It is fantastic at killing fast-growing cancer cells and immune cells, but it's not smart. It can't tell the difference between a cancer cell and one of your body's healthy, fast-growing cells. So things like your hair follicles, the lining of your stomach, and especially the stem cells in your bone marrow that make all your blood, they all become collateral damage. And remember when the liver activated the drug? Well, it turns out when it creates the helpful weapon, it also creates a nasty byproduct called acrolein. This stuff has basically zero anti-cancer effect, but it is incredibly toxic. And as your body tries to get rid of it in your urine, it literally attacks the lining of your bladder, causing intense inflammation and bleeding. It's a huge problem. And that's just scratching the surface. The side effects tend to come in two waves. In the short term, you've got the immediate stuff. Your bone marrow gets suppressed, which tanks your immune system. There's the nausea and hair loss, and of course, that bladder bleeding. Crucially,
The risk of infertility is also immediate, and for many people, it's permanent. But then, there are the long-term risks. Because this drug damages DNA, years down the road, it can actually cause new cancers, like leukemia. And it can also lead to permanent damage to the heart and lungs. So with a rap sheet like that, you might be wondering, why on earth do we still use this? Well, this is where the art of medicine really shines. Using this drug isn't just about giving a dose, it's a constant clinical tightrope walk to get all the benefit while trying to avoid the harm. So this is the puzzle. How do you use this incredibly powerful double-edged sword without seriously hurting the person you're trying to save? The answer is all about being proactive and using really clever, targeted strategies to protect the body.
Let's go back to that bladder problem with acrolein. The solution they came up with is just brilliant. It's a two-pronged defense. First, hydration. You give the patient tons of IV fluids to dilute that toxic acrolein and just flush it out of the bladder as fast as possible. But second, and this is the really cool part, you give another drug called Mesna. Mesna is like a chemical bodyguard. It goes into the urine, finds the acrolein, and binds directly to it, neutralizing it before it can ever touch the bladder wall.
And I am not overstating this. Mesna was a total game changer. It's considered a revolutionary advance because it took one of the most common and feared side effects of this drug and gave doctors a direct, effective way to stop it. It made cyclophosphamide dramatically safer to use. But the protection doesn't stop with the bladder. It is a full-on regimen of constant vigilance. Doctors are relentlessly monitoring blood counts to watch for infection risk. They're checking liver and kidney function. And critically, before treatment even starts, there is a mandatory, serious conversation about preserving fertility, giving patients the chance to freeze eggs or sperm before starting a therapy that might take that choice away forever. So what we're left with is this incredible story. Cyclophosphamide is still this indispensable, life-saving medicine, but it's also a blunt instrument, a relic from a time before we had super-targeted therapies. Its entire history is a masterclass in risk versus reward, and it leaves us with a really fascinating question to think about. As we move into this new era of smarter, more precise drugs, how will we build on the lessons we learned from taming a powerful beast like this one? What will that next generation of powerful but much safer medicines even look like?